Oh, God.
Roll call, Cassandra, please.
Okay, Hathaway. Hathaway, you're muted.
I'm okay now. I'm here.
LaSchultz,
Here.
Burns,
Yeah.
Gilbert,
Here.
Chartran,
Here.
Morahan.
Here.
Holzer is not on yet. And Osborne,
Here.
King,
Here.
Dahlhoff.
Here. Please stand for the pledge. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Hey, Jerry, you're not green.
The 4/7/2020 board meetings have been distributed. If there are no amendments, they will stand approved. Report of the Finance and Rules Committee per Rule 6, Cassandra.
The Finance and Rules Committee has met and they recommend to waive rules to act upon late resolutions.
Need a motion?
Moved.
Ron, second by
Tom.
Tom. Any further discussion? All in favor?
All right.
Aye.
Aye.
Opposed? Motion carries. Presentation of petitions, communications, and notices. Cassandra?
A resolution was received from Seneca County for supervisors to call on New York State to release enhanced federal Medicaid matching funds to counties and New York City. Schoharie County submitted a resolution requesting New York State to restore state retirement service credits to Schoharie County workers who temporarily lost those service credits due to the county's temporary workforce reduction. That completes that report.
Okay, hang on a minute. I just screwed the screen up here somehow.
Just go down.
Okay. Reports of county officers and departments. Cassandra?
Legislators have received copies of the Treasurer's April report, the April Highway and Solid Waste Department audit reports, minutes of the April 22nd Youth Bureau Advisory Board meeting, and the following apportionment of mortgage tax report for the time period of October 1st, 2019 through March 31st, 2020, with a grand total of $199,389.50. And that also includes the warrant. That ends that report.
Thank you. Reports of standing committees. Tom, would you like to start with finance and rules, please?
Wake up.
Thank you, Mr. Chairman. I have nothing to report at this time.
Any questions to Tom? If not, we'll move on to Jerry with general services.
He's muted.
Okay, can you hear me now?
Yep.
Okay, I got two motions. I'm gonna make the first one. A motion to award the bid for all, excuse me, roadway markings to Seneca Pavement Marking in accordance with the 4/7/2020 bid summary sheet on file with the clerk of the board. So I'd like to make that a motion.
So moved.
Moved by
Ron.
Jerry, second by Ron. Any further discussion? Jerry, do you know what the plan is, if they're gonna do that this spring and get away from the fall schedule?
You and I talked about it. I did not ask any more. I will give them a call tomorrow and see what their intentions are.
Okay.
I think we get more longevity out by doing it in the spring.
Right. I asked Ryan to follow up with Warren to see if, I know I had a conversation with Warren and I think that was the plan, but I just want to make sure, that's all.
Okay. Yeah, I'll check with him and let you know.
Okay. Anything else?
Yep, motion to name,
Hold it. Any further discussion on that motion? If not, all in favor?
Aye.
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 Opposed? Motion carries.
Okay, my second motion is to name Cassandra Buell as interim director of planning at a salary of $61,550 effective retroactively till March 9th, 2020.
I'll move.
Moved by Jerry, second by Ron. Any discussion? All in favor?
That's
Aye.
Opposed?
all I have, Mr. Chairman. Thank you.
Any questions for Jerry?
Jerry, what was that effective date again?
For Cassandra,
Yes, sir.
March 9th.
Okay, that's what I thought. Yeah. Thank you.
You're welcome.
Okay, moving on to Randy with Health and Human Services.
Thank you, Mr. Chairman. Just, I want to reiterate how appreciative we are with all of the efforts and sacrifices of our county employees during this COVID-19 issue, and to give an expression of gratitude to our Lewis County residents and businesses who have been both innovative and generous to help meet the needs of our citizens during this time of crisis. Whether it involved mass production of PPE and hand sanitizer, hand sewing masks, a donation to our local food pantries and charities, providing meals to those in need or on the front lines, getting takeout to keep a local small business afloat, or something as simple as reaching out to a friend or relative with kind words and compassion, just to name a few. However, any and all gestures are greatly appreciated when we are all completely out of our normal daily routines. We have gotten this far with many sacrifices and changes. So with perseverance, common sense, and a little more patience moving forward, we are on the road to getting our lives back to normal and getting Lewis County reopened. With that, I give my sincerest and most grateful thank you to each and every one in Lewis County. And that's all I have, Mr. Chairman.
Thank you, Randy. Any questions for Randy? If not, we'll move on to Dick as the board's rep to the Hospital Board of Managers.
Yes, Larry, I'm going to yield to Mr. Kayer. He's on the call with us too, because our meetings have been about like the ones we're having at the county. Jerry, if you're there, go ahead.
Yeah, thank you. Not much to report since last month. Probably the big news is we have purchased an analyzer that will allow us to test for the COVID-19 virus locally. $60,000 piece of equipment. We're able to make that work within our capital budget by just swapping out some things. And the foundation reached out to me, and we're going to be having a virtual auction, and they've committed the proceeds of that auction to help pay for the equipment. So in the spirit of the community engaging, this is just another one of those. We implemented a furlough almost 2 weeks ago. It was a tough slog negotiating with CSCA, but we got there. We're projecting that we will save $250,000 per month during the period of the furlough. So that's going pretty well. We got communication recently that we are expecting some additional federal resources to come our way. There isn't clarity on what that amount is at this point. However, early in the COVID experience, we received $1.5 million in 2 installments, and that came in very handy as April was a 3 pay period month. We have yet to close the books on April, but we are projecting somewhere between a $2 million and $2.5 million loss for a total loss of the 2 months of over $4 million. That 1.5 will be set against that, so it should bring it down some. We continue to have daily briefings with the Department of Health, Haney's, and once a week briefings with IHA. At this point, we're just anxious to have elective surgeries begin, and they begin in earnest on Thursday. Between Thursday and Friday, we will have, between Thursday and Friday, we will have almost 10 surgeries, and we'll be back to a normal schedule next week. The conditions of surgery is we have a certain stock level of PPE, we have a certain number of beds available in the hospital, and that every surgical patient is COVID tested no earlier than 3 days before surgery. There are some logistics that we're working through because it is not easy to turn over a COVID on Sunday for a surgery that will occur on Wednesday. So we're working through those logistics now. So no day is boring. I think the staff are stepping up and working through this. And, the good work of public health has, set up Lewis County very well. As you know, we've only had 11 positives. And, as a county, we are probably doing the best of any of the 62 counties in New York State. So that's my report, unless you have some questions.
Jerry, just one question. When do you think you'll be able to start testing locally? When will that equipment be operational?
Yeah, that's a great question. There are 3 parts to being able to do the test. The first is getting the equipment in, and we're projecting it'll be in by the end of next week. The second part is calibrating, and so we will have to run somewhere between 40 and 80 tests to make sure that the machine is set to all the right specifications. And then the third component is the receiving of the reagents. So it's the chemicals that are used during the actual test. And that's the last piece of the trifecta, if you will, for us. And at this point, we're getting mixed messages on the reagents, and we may not receive them until June. So what's happening nationally as it relates to the state of New York, there are 2 things we need. We need the test swabs. Those are those long sticks that look like a Q-tip that go, into your nasal passage. And then the second are the reagents. All of those products are coming into the DOH, both from the feds and the manufacturers, and then they're distributed. And right now, there isn't balance in how those items are being distributed. And I was briefing Ryan earlier today that I had a nice conversation with Representative Stefanik this morning, really expressing my frustration with how difficult it is getting product to the North Country. She understands it, she's on top of it, and she said, I'm hearing it from all of the hospitals in District 21. So that's a long answer to what should be a simple question, but it could be anywhere from 2 weeks to 6 or 8 weeks before we're able to do the test locally.
Thank you.
You're welcome.
Any other questions for Jerry? Thank you, Jerry.
Yeah. I have a quick question, if you don't mind. This is Ron.
Yeah.
What's the intent, Jerry, when this thing's up and running? I mean, is the intent to test everybody in the county?
Yeah, well, the goal is, and Ryan will probably brief the group on this shortly, the governor's formula requires that we test 810 residents of the county per month. I know this week we're taking all samples on the nursing home residents and all the staff at the nursing home. Just that action alone will give us 400 tests. Now, we're not going to be able to test those locally. We're sending them to a reference lab. But ultimately, what we have to achieve is 810 tests per month. This analyzer will allow us to do 1,800 tests a month, running it if we ran it 3 shifts. So with 2 shifts, we should be able to more than meet the standards set by the governor. And if we can ensure a steady supply of the swabs and the reagents, I think we'll be good to go. Now, understand that testing at that level is really to get a snapshot of the virus in the county. So we shouldn't do 800 people from Lowville. We should do, you know, all of the population centers. We should have folks from Harrisville, Lion Falls, Copenhagen, I'm forgetting Krogan. So that's how we have to approach it within the framework of the population, the priority populations. So healthcare workers, emergency responders, educators, and there's some essential workers and other industry. Those are the folks who will want to test first, but eventually we want to get down to as many residents as we can. It would take 33 months at 810 tests per month to test every resident of the county.
Okay, thanks, Jerry.
You're
Gary, would you, like, we have a medical center up here, would you come to it instead of, 50 people coming to the hospital?
Yes, that's exactly right. We have the clinic in Harrisville. We have a clinic in Krogan. At some point, when the DOH approves it, we'll have a clinic in Copenhagen. We have South Louis. So that would be the plan, to deploy the team to the clinics, or it may be to a high school gym, for example. If we want to test the educators at South Louis or at Harrisville. So that's the intention. We would deploy a team out to take the samples.
Good plan. Thank you.
Yeah, you're welcome.
Jerry, I've got a question for you.
Sure.
This is Greg Halser.
Okay, there you are.
Could you go into like Kraft and test all 3 shifts of their staff? I mean, that would bring us to 800 and total for the month pretty quickly.
Yeah, I think eventually we would be able to do that. I think the hard part, and I had that experience a couple of weeks ago. You recall on the 21st of April, the governor said on April 28th, we would be able to do elective surgeries. He then issued a document that laid it out. And so we started the process. On April 27th at 1 PM, I received a notification that the DOH had not sent the guidance. And guidance is another word for directives. And now the guidance or the directives were not anything unusual, because we sort of knew what we needed to do to be able to have the surgeries. But because the DOH didn't sanction it, at the same time the governor made the announcement, we had to cancel several days of surgery, waiting for this document. Then once the document came in, we had forms we had to fill out, and then I had to complete an attestation under the threat of, legal action and losing our operating license. So I think at this point, Greg, what we'd have to do is we got to be clear that the DOH sanctions our testing process and the groups that we're going to test. Right now, we do know healthcare workers, people in long-term care, and other essential workers like public safety officials are the folks that we would test first. We have had industry reach out to both public health and us. Would we test their employees? So once we get the guidance, we would do, and the supplies, we would be happy to go out to our employers and test there. It only makes sense, like going to the clinics. So
well, they are considered essential.
Yeah, exactly. So essential is about 4 or 5 down the list, believe it or not.
Let me jump in for a second. Larry, can you put yours on mute? Mute. Okay, hold on.
If everybody would mute while one person is talking, the sound will be better.
Well, it's just because we're in the same room.
Yeah.
Right now, assuming we had the capacity to test. Oh, we've been talking about that. The order of state would be symptomatic people would be first, which is what we're testing right now. Contacts with people who have symptoms would be second. Healthcare workers and first responders would be third. And then, as you mentioned, Greg, essential workers of all kinds would be fourth. So that's kind of the current guidance that we have from the state.
Are we good with that at this point?
Sorry, Larry, say that again. I had you on mute, sorry.
Oh, I said, are there any other questions? If not, thank you, Jerry, and we can move on to the county manager report, Brian.
Thank you, Mr. Chairman. So building off exactly what we were talking about, I wanted to talk a little bit about the regional reopening plan. The governor laid out a 12-point plan that basically can be divided into 3 categories. The first is your testing numbers. They have to be low for a sustained period of time. Obviously, for Lewis County, that isn't a problem. Ours have remained low. Our hospitalizations have remained low. The second is we have to have excess capacity in our healthcare system. That, again, for Lewis County has not been a problem. We have excess beds at the hospital. We have excess ICU beds. We have done well with PPE. So we meet all of those categories. But the last category is testing. And this is exactly what Jerry was talking about, 810 tests per month in Lewis County. That's going to be the challenge. And we, are going to struggle to get the equipment that we need to get that ramped up. If the Pause New York is going to end on May 15th, and then the governor's turning it over to the regions on May 15th, and say, the regions have to meet these reopening criteria, it's pretty clear that our region is not even close to meeting that criteria because of the testing capacity. And so Lewis County is one of the smallest counties, will be one of the first to be able to hit testing capacity. And as you heard from Jerry, we have neither the swabs nor the reagent to be able to test that. So unless the state or the federal government step up in a big way, or we find a way to tap our local manufacturers for some of this equipment, that's going to be the challenge that's going to hang up our region, in my opinion. We check every other box other than that. So,
Brian?
Yeah.
Just a quick one. Didn't Jerry say they were going to be testing the nursing home residents and the staff there this coming week or next week?
You
So
want,
that'll be, that
I
plus
can address that if you
300
like, Ryan.
Yeah, go ahead, Jerry.
So the nursing home the DOH reached out to us on Sunday wanting a census count and the employee count. And I believe today we received the swabs to do the tests on the residents and the employees. And then we packaged that up and we're shipping them out.
Oh, so it's already been completed?
No, it hasn't been completed. We just received the swabs today, I believe. And it will be completed this week because they've given us a deadline.
How many residents?
Enough to do 140 staff and, 140 residents and probably close to 200 staff. So they gave us just enough for the residents and the employees of the nursing home.
That sounds like them.
Called for a number.
So I mean, I think that's a good point, Greg, that we're going to, even if we get this off the ground, which we will this week, we'll test all these people. Okay, great. That's 300 people. We still have 500 more people we have to test. And we only have in our supply right now 200 test swabs. So if we're going to do 800 a month, not just this month, but every month going forward for the next, 18
We
months.
can't count the ones that have already been tested. We've got 368 tests currently.
Right, over basically 2 months at this point, 6 weeks, we've done that many tests.
So
So,
we can say it all started this month.
so the state is not being 100% clear about this testing at all. We're waiting for a lot of guidance on what they mean by 810 per month. Do we have to perform those tests? Do we have to have the capacity to perform those tests? Do we have to have the amount of equipment on hand so that you could perform that many tests? Those are all questions that we don't have answers to. But even the very basic first category of, do we have the equipment on hand to perform those tests? The answer is no, we don't. So testing is going to be, in my opinion, the hurdle that our region has to get over in order to get into that phase 1 of reopening. So,
Or we just do it anyway. There was a county in California that did it.
3 of them.
There you go.
well,
If we can't obtain the tests or the swabs, we're being held back because of him. I'm sure that they have plenty in New York City.
Well, if they have to do 30 per 1,000, then in New York City, downstate with 12 million people, they'd have to have, a lot more than 810. But I think you're right, Greg. I think the whole state is not really close to this threshold that's been set. We need a lot more tests and a lot more processing capacity, no doubt about it. So having our machine in-house is going to be wonderful in the long run. In the long run, if we could set up a local supply chain with this testing equipment, I actually have a swab, but I ran out of my office. I wanted to show you guys, but it's over there on my desk. It's a $2 piece of equipment. It is it's a cotton swab with a vial of saline solution. It's very simple. If we could build a local supply chain, that's kind of where my mind is right now. If we could get something going that could sustain our region over the next, there it is right there. Pretty simple. If we could get something going locally, I think that would go a long way. I think that would sustain us. This testing regime is not just going to be something that we ramp up so that we can open the economy again. This is going to be part of our lives and part of public health's job for the next 18 months, easily, no doubt about it. So, we are going to need a steady supply of testing equipment, and whether it comes from the federal government or the state government or right here locally, it's something that we've got to figure out in order to get things up and running again. So,
I got one more question for Jerry, if he's still on.
Yes, I am here.
Jerry, the equipment you purchased, the testing equipment, is that just for COVID, or are you going to eventually be able to use it for other testing?
Yeah, we'll be able to use it for other testing that we currently send out to reference labs. So number of STD tests, MRSA, those kinds of things.
Oh, okay. Thank you.
Yep. Yeah, in fact, we did the financials and we're a little bit better than break even when you throw COVID with the other testing.
Good. Thank you, Jerry.
So I guess that's where we stand on a reopening, regional reopening. I think there's a lot more questions than answers, but it's pretty clear that we're not going to hit that box for testing, at least in my opinion, very unlikely that we'll be able to hit that by May 15th. But, stranger things have happened, I guess. The second thing I just want to touch on is the financial situation in the county. We talked about sales tax at the Finance and Rules Committee last week, or I guess 2 weeks ago. What has come out since then is the governor has announced a preliminary plan of what some of the state budget cuts will look like. What he's talking about is 50% cuts to localities. I think I've sent some emails on this topic, but last year the county received $7.2 million from the state. So if you take that number and cut it in half, you're looking at, you know, over $3.5 million. I think it's unlikely that we'll receive a straight 50% cut. There's some things that would be very difficult for the state to cut. Eric and I have done the math, and we think it's probably, you know, worst case scenario closer to $2 million. But still, that's, you know, that's not chump change. That's important to us. What I want to really emphasize, though, what is so strange about this pandemic that we're in right now, this disaster, is that we have received $0 from the state government, and we have received $0 from the federal government. I can't tell you how out of place that is in a disaster situation. You know, when this nation has dealt with hurricanes, even when we've had windstorms or flooding in the past, we have received aid from the state and federal government. We in Lewis County to date have received nothing, and none of the counties, unless they're over 500,000 in population, none of the counties have received anything. And so there is a bill, another stimulus package that Senator Schumer is working on, that his office sent me a note that Lewis County share would be $1.9 million direct aid to localities. That is extremely important to us. So, you know, that would help offset some of our expenses here, but I guess I just wanted to put you guys, you know, help you understand that we're kind of in uncharted territory here, where we're in the midst of, you know, our version of a hurricane, our version of a tornado, and we're getting nothing from the state or the feds. And that is pretty strange. So we'll talk more about some of the other financial consequences later in the meeting. But anyway, that's my report. I'll take any questions. You're on mute, Jerry. Hey, Jerry, if you're trying to talk, you're on mute.
No, I wasn't trying to talk.
Jerry.
Jerry
Okay.
King.
With the swabs and the saline that we're having trouble getting, and you're talking about coming up with another solution, are they that hard to generate?
I don't think so. There's actually, the CDC has put guidelines on its website on exactly how to manufacture these things. They're pretty simple. They sell for about $2 a pop. So, you know, my hope is that someone locally might be able to make these, or a combination of local producers, local manufacturers.
Okay.
But we got to work with them.
What is the chemical composition of the reagent that we're going to be in dire straits for?
I don't know about the reagent. I know about the saline. I don't know about the reagent. Jerry, do you know?
Yeah, no, I don't know it off the top of my head. I think at this point, the most important thing is the production of the swab, and it has to be produced in a sterile process. And that's probably the biggest hurdle to cross from a manufacturing point of view.
Thank you.
Yeah.
Okay, back to you, Mr. Chairman.
Any further questions for Ryan? Thank you, Ryan. If not, we'll move on to County Treasurer Report. Eric, please.
Yes, is the audio okay?
Yes.
Yep.
All right, thank you. I sent out a written report earlier. I'll just make a couple of notes on that report. Right at the very beginning, I would just update you. I have probably spent most of the last 6 weeks quarantined in my office, working to prepare for our audit and our annual update document for New York State. Those have gone well. Our audit is basically completed, or the work is completed. The auditor will finalize the report over the next month or two. And the annual update report was sent into New York State on Thursday. So I'm happy that those have been accomplished at this point. That's definitely been a significant time factor for me and a great part of my learning curve, I will say that for sure. So I'm happy to have those somewhat behind us. I would note that our annual tax auction was scheduled for tomorrow. I think we've updated you in the past that has tentatively been delayed, and at this point, we don't even really have a new dates established. We had talked about a date in June, but I don't believe that is going to be able to be accomplished in June either. So we will be working with the auditor and also with the county court. That's kind of a key next step, is a court process to be able to move forward with that. And we will hopefully be able to establish a date at some point later this year. The remainder of my report reflects some information on sales taxes and our reserve balances, and I will answer any questions as best I can on those if you have any questions.
Any questions for Eric?
No, I'm good.
Thank you very much.
Thanks, Eric. Report of the Finance and Rules Committee per Rule 7, Cassandra.
The Finance and Rules Committee reports that they have examined the claims presented for payment in the total amount of $1,659,119.77 and recommend that they be audited and allowed for the amounts claimed.
Need a motion?
I move.
Wendy,
Second.
by Ron. Any further discussion? All in favor?
Aye.
Aye.
Opposed? Carries. So we can move to resolutions at this point.
Okay, the first one is auditing and allowing claims in the amount of $1,659,119.77.
Don't want to move that.
Moved.
Ron,
Second.
second by
Second.
Second it.
my Greg. And that's a roll call.
Chartrand. Chartrand,
Yes.
Gilbert,
Yes.
Morahan,
Yes.
Burns,
Yes.
Colzer,
Yes.
LaSchultz,
Yes.
Osborne,
Yes.
Hathaway,
Yes.
King,
Yes.
Dahlhoff.
Yes.
Okay, the next one is the introductory law number 4, 2020, and setting the public hearing for June 2nd, 2020 from 5 to 5:30 p.m.
Mr. Chairman, before the board considers that, I want to point out a typographical error on page 2, section 4, under definitions, section B4. Second line should read, vehicle trail system with 25 or more concurrent vehicle units or 50 or more concurrent participants. And that change I will make and resend to the Board of Legislators immediately after the meeting, so we're in compliance with you having the correct introductory law before the public hearing.
Okay, so we are just moving this to set the public hearing. Is that correct, Cassandra?
Yes, that's correct. I need a motion and then a second.
Okay, so I need a motion to accomplish that.
Moved.
Ron, second by
I'll second it.
Ian. Any further discussion?
This is just to move it forward for a public hearing, right?
That's
Correct.
correct.
Okay, because I personally don't feel that this is a necessary law, the way it's written. I mean, we're restricting our citizens from parades and special events like on their own property, for crying out loud. You know, vehicle and traffic law plays a role in the roads, so that if you're parking alongside the road, there's a problem, they could get ticketed by motor vehicle law. We don't need to produce another law. I think it's just another crock. This was really meant for ATVs, but it's ballooned right out there. And our county taxpayers are paying for this stuff.
Yeah, I think we've gotten carried away with our original intent a little bit.
Yeah. You know, walking. So you got a group of 20 walkers walking together. They gotta get a permit, what, 60 days ahead? They don't even know that 60 days ahead. This is a farce. And who's gonna enforce it anyway?
I
I don't hear any answer to that one.
Do you want to make any comments on that, Joan, or?
Again, if you look at the definitions under section 4, your suggestion, Greg, about 20 walkers on the road, that would not apply, where they would have to
be 25?
Right.
Oh, so 25.
No, no.
Then you need a
If it
permit.
was if it's an organized event, if it's just a group of students out for a run in the afternoon or something, that would not be considered a special event.
Yeah, it's just another. Who's going to enforce it, Joan?
Well, we could say that about a lot of our laws, but
Yeah, there you go.
Yeah.
So it's
but
just
that's
another piece of paper.
Greg, what would you think if the law were just limited to the trails? You know, if we took out, I know I'd mentioned this in the email to you, if we took out under that section 4B, 1, 2, and 3, and just limit it to the highway or off-highway trail system, and then you've got, 25 or more vehicles and 50 or more people, because it's easy enough to change it just to take those things
Yeah,
out.
that would be fine. But let's get rid of the people that are going to have a parade like in Brainerd, as if that's not publicized enough. I mean, they have a parade every year in Brainerd. Well, not this year, they won't, but normally, so I think we're restricting our citizens, forcing them to fill out a permit that basically and pay a fee that really isn't going to make a difference, because if they did it without doing it, nobody's going to do anything about it anyway. So it's just another piece of paper written, but if it's meant for vehicles and trail system, then that's worthwhile, because that's where the damage is. But we don't collect the insurance anyway, so.
Larry, can I ask you a question?
Who, me?
No, Larry.
Oh,
I'd like to
Larry.
ask Larry a question. If we're still Zooming in June, are we going to have that public hearing? Because people won't be able to come and tell us what their thoughts are.
Joan, can you respond to that? I don't think we can.
I personally would not recommend that we do that. If the only way we could do that is to tell them now, send out a notice when we publish the notice for the public hearing, that they have from now until the hearing to send in their written comments, either by mail or by email to the clerk of the board. And with that being said, we normally do not pass any kind of or have a public hearing without the ability of the public being able to participate in it on the date of the hearing. So, it would be difficult. My recommendation would be, if we see that we can somehow have public participation at the June meeting, that we would adjourn these for another month.
I would agree with that.
Then would it be better off that we maybe table this until such time as we can have a public meeting?
That
Well,
sounds
we may be
logical.
able to have the public meeting for June,
We may, but we may not.
right?
There'll be a lot of restrictions with size possibly.
So that's up to you, what you want to do. If you want to, somebody would have to make a motion to table this.
Well, let
Can I
me
make-
ask the question, if we set the public hearing for June, how difficult is it to table it at that point, rather than starting the whole process over?
You can table it then.
So it would be okay to move this forward today, and then if we can't hold a public session in June, we would table it until July.
Right.
Is that how
And we
that,
would republish.
okay. Is everyone comfortable with that?
Yeah.
Larry,
Dick, go ahead.
Larry, can you hear me? Yeah, this is Dick. I think there's enough, what I'm just listening to here, and myself included, it almost looks like you're trying to drive a thumbtack with a sledgehammer or something on this thing. I think if we understood the impetus behind why was this even started and stuff, it may help to give us a little more understanding to it. Because I'm thinking like the fire departments all have parades and stuff. I don't know the difference between a county road and a state highway. So it probably doesn't cover anything on a state highway, but it just seems awfully in-depth if we're trying to do just one thing, which is off-road trails.
Well, my response to that is, over the years, I've had a lot of requests from various towns, particularly the hill towns and the town of Martinsburg, that the county move something forward like this. You know, there's been discussion surrounding mow down, and that we don't have an event permit for that. So that's where this evolved from. I think we understand, the onus that it puts on small parades like Snow Pals with the one in Branningham. We've tried to allow them to come in underneath a requirement by saying, with 25 vehicles. We've limited the people having a outdoor gathering on their own property. It has to actually cause a safety or damage to county roads or trails or other land. So, trying to put the whole picture together and make everyone happy obviously is quite a challenge, and so I don't know what we could do to address that.
Well, that's more information than we had. Thank you for that.
Well, my only comment, Larry-
I tossed the question around of excluding, as Greg and Tom allude to, and make it just to trail systems, and then I get pushback from the outside, from residents and stuff that want it in there. So, it's a constant seesaw, I guess.
The Snert
That's for
Run,
sure.
the Snert Run, for example, doesn't run on our trails. It only runs on roads. So, a lot of these ATV events are running on the roads. So how do you, we've been at this now for 2 years with an event permit, and we bring something forward. We hear some criticism. We try to go back and address it. We bring something forward. This has gone through committee now 4 separate times since I've been manager. So,
Well, yeah, I understand what you're saying, Ryan, but we've brought up the same thing each time. This was meant for ATVs and UTVs. Those are the ones that are damaging the roads. And yes, I understand that they run the county road for the Snert Run, but And I understand where Larry's, what he's saying, but the towns, if they want to control it, they can make their own law for their own roads. You know, they can make a fee, a permit fee in their own town if you
And
want to
that-
run their roads.
And
I mean,
Greg,
we don't
that's-
have to do it for them.
Greg, that's precisely what the town of Martinsburg is looking for, is a county law that they could model a town law from. So,
Correct. Now they could. But we don't have to make it a law that expands it out to parades and family gatherings and weddings and everything else. You know, I'm sorry, but there's a lot of taxpayers out there that find this to be more of a burden for them. And they're already paying taxes. They're the ones that are paying the taxes to keep the roads up.
So I think the original intent was to, we continue to talk about Lewis County becoming a destination for recreation, a premier destination for outdoor recreation. And we continue to have, our businesses that are growing and wanting to do events like Larry mentioned with the mow down. Right now, we have no way of knowing what events are happening in the county, whether it's a road event, whether it's a large concert, we don't know. And there's no way to compel the organizers to sit down in the same room with us, with the sheriff, with Jackie, with the town supervisors, and to talk about this stuff. So these events are just happening and we're reacting. So the whole goal is to put us in a position where we at least are participating in these events for public safety, for, as you mentioned, Greg, the potential damage to our infrastructure. If we want to start, if we want to continue to push Lewis County as a destination, then we have to take a professional approach to the way we handle events in our community. We can't have it be the Wild West, but have the event in Lewis County because you can do whatever you want there. We have to have some way to coordinate with those organizers. We have to coordinate with them in order to keep people safe and to keep our roads safe. So that's the intent. Maybe perhaps some of this language got lost along the way, but that's what we've been trying to achieve for the last 2 years.
Well, we've been at this forever. I mean, we sat down when the mow down started and all this stuff. But can't you set, and that's the direction we were headed at one time. The big stuff we want to control, the little stuff we could really care less about. And we can always add to this law. So I guess my question is then like the mow down. Why can't we put stuff in there? Because they're using the county road and this and that. But do we have to blanket everybody into it the first go around?
Jerry, I think that this was sort of the reason why we went back to it in the last few weeks and made the changes that we had. And I sent an email out sort of explaining what we did. That section B, it looks similar, but we added some stuff to really limit the class of people that would actually fall under the permitting. So we added to where was it?
Well,
to B1.
Spell out who we want to get a permit and leave the other ones alone, not exclude them, because I really have a problem with us taking the public and telling them what they can and can't do on their land. And we have a law for the county roads. If there's too many people parking on them, it's up to the sheriff to take care of them, not us to set more standards. So why don't we do what we want to take care of is the ATV trouble, the mow down, and a few other big ones we have, and leave the rest of the stuff alone for right now.
Yeah, I'm not sure how you would phrase a regulation that would just apply to say mow down, but not to other types of
Gatherings.
events.
Well, gatherings over 250.
Right.
Damn well they have more than that. I mean, it seems like every time we start a local law, we just keep adding more and more crap to it.
Thank you.
Yeah, I think it's significantly I wasn't here when you guys first started on this, but it's much more dialed down from where it was before. It only applies to formations, parades, processions that interfere, impede, or obstruct the flow of traffic Organized events on private property that cause safety concerns or damage to county roads, trails, or other lands. Those are really specific instances. That's not going to apply to 99% of gatherings.
Well, you can put in what you want, Ian, but I think there's more people on the committee.
Oh yeah, no, I'm just
Right
saying
now,
this
the
was,
way it's set, don't count on me to support it. We haven't watered it down enough. So.
yeah. It really, the reason we kept it in, you know, and I mentioned this is because if you're going to have a permit, let it be one type of permit so that you don't have, you know, multiple types of permits for different types of events. And then you put very simple rules, post them online so people can go and see, you know, do I need a permit for this event? And if they don't meet the criteria, then they don't need it.
Okay.
So if you're having a parade, do you have to have insurance?
Yeah, it reads that.
It reads that way.
Gotta have $1 million to $2 million policy.
Yeah.
No, the last provision of that gives the authority to,
Waive it.
section F of that section of the insurance gives the discretion to Jackie to adjust the amount depending upon the size and nature of the event.
And I don't think that insurance is very expensive anyways. $1 million policy for a single event. I mean, farmers markets, the vendors are required to have policies that cover them. So it's not, I mean,
Right.
That's certainly within their budget. You know, it's $1 million policy, but it's going to be, you know, it's going to cost as much as, you know, what is the risk of actually having an incident that's going to require $1 million of coverage.
I look at outfits like the American Legion in Krogan that has a parade once a year or once every 3 years in New Bremen. They rotate with Krogan and Beaver Falls. I don't think they need to spend money to get insurance, whether it's $4 or whether it's $400. I don't think they need to be doing that. So I'm with Jerry. I'm a no on this, even if it moves forward.
So am I.
So can I ask a question? What does this look, you know, what's the next iteration of this? Because we keep going back to committee and then back to the board, back to committee, back to the board. There've been 2 years on this. You know, how do we move this forward? What do you guys want from staff to take this policy to the next level, or are we done talking about event permits? What comes next?
I personally think we need it, but I think we need to keep it intact to the stuff we want to affect and leave the rest of the stuff alone.
That's right.
I've
ATVs
said
is what
that
it's meant
before.
for.
Every time we get on it, we just keep adding more crap to it.
And the only concert you've ever seen here in Lewis County is Modown. I mean, so you could put that down as a concert, you know, and ATVs, groups of above 50.
Well, let's do
Actually,
That's where
Greg,
the
there is a
damage comes
concert
from.
down at, on the East Road there where the Bossert Farm used to be. That's a bluegrass and stuff, and they have trailers and everything else. They definitely would come under this.
Oh, yeah, I forgot
Actually,
about that. The Mennonite community.
Dick, actually, that would not, because that's on private property. They do not park on the road, and that's not a county road there. That's a town road.
Number 3, or the East Road?
The
Oh,
East
They don't
Road,
park on the road.
right where Maple Ridge is, they don't park on the road, first of all. They park on the property, and that's private property.
Drive down through there next time they're having one of them.
No, Dick, they've never put cars out on the road. They have plenty of space up there, but that's just one event.
Ian, I've been by there every time they've had it, and there's the road's full of people. You've got to slow down to about 5 miles an hour to get down through there, and there's been cars on the road.
Okay, so it's obvious that I don't think there's a majority support for this. So would you like to table this, send it back to the committee for direction on exactly what you want in this thing, or where are we going with this? Are we just giving up on it, throwing in the towel? Do you want anything? Don't want anything? What would you like to do?
I'm willing to take it back to committee if people want to send it there. I do think we need to do something. And I think we need to take care of our major problems first and then build on it over time.
So my recommendation, Larry, would be is that somebody needs to make a motion to basically rescind the motion that you passed before to move it forward for a public hearing.
I'll
Okay.
make that motion.
I'll second it.
Second by Greg. Any further discussion? All in favor?
Aye.
Aye.
Opposed? So that carries. Now, do we need a motion to send it back to committee, Joan?
No, we can just, we'll know, Ryan will know that the committee will look at it.
I'll make sure it's on the agenda for May 20th, whenever our meeting is.
Okay, very good.
Thank you.
The next resolution is local law intro number 5-2020 and to set the public hearing for June 2nd, 2020 from 5 to 5:30 p.m.
Someone want to move that?
I will, Larry.
Moved by Jerry, second.
Second.
Tom, discussion? All in favor?
Aye.
Opposed? Carries.
Did you want me to do the rest of the resolutions as a slate, or do you want me to go through them individually?
Does anyone have any resolution that they would like to pull out for discussion, and then we'll move the rest of them as a slate?
We already talked about the
you're on mute.
one that I had.
Phil, you're on mute. Phil. You're on mute.
There we go. Thank you. Sorry about that. I just only had one question. I don't have a problem. I just want one clarification on resolution number 129 for the defender one. That money, Ryan explained to me that it comes from the state because we weren't properly taking care of the people. So is that money in addition to the 404,000 that we commit to public defenders? Ryan?
Yes, part of the deal was it's this new money cannot supplant any existing support to public defenders.
So in the 404,000 plus the 576 for 2020, they're going to get 980,000. And do they have to justify that extra money, or is it just an automatic thing?
Yeah, there's three categories that they can put the money towards. Basically, the three prongs of the Harrell Herring lawsuit. One is counsel on first appearance, so that we have to have a public defender at every single arraignment. The second is they have to spend it on caseload management. So any one public defender can't have more than a certain number of felony cases at once. So, load management, making sure every case is getting the correct amount of attention. And then the third thing is data. The state wants more information on caseloads, and they've got a whole host of data. Basically, Lewis Defenders is going to hire a complete one whole person just to comply with the state's data requirements in terms of caseloads and time spent on each case and everything. And actually, part of the Lewis Defenders plan for this 5 years is to put an addition on their building because they're going to have more attorneys and more paralegals, more people. They can spend the money on experts, more expert witnesses, more expert testimony at trials. This is a pretty big deal. Definitely, quadruples the public defender budget in Lewis County. Yeah.
So they have to prove themselves, Ryan. They have to prove that they spent the money and needed the money, and Okay, that's good.
Yeah,
I'm good with it.
Joan's more involved with the specifics. Do you know more
Yeah.
about that, Joan?
No, Ryan, you hit all the important aspects of what the intention of the additional money is. And each year, with Ryan and I and Mike Young sit down and go through what his proposed work plan is for the use of the funds that the state will give. The state then approves each one of our yearly plans going forward. The thing that I would like to also mention is that unfortunately, what this does not address is the cost of indigent defense in the family court, which is our big expense item. But we're hoping that down the line that eventually the family court indigent services are also going to be brought into this funding.
Thank you. Appreciate it.
Okay, that'd be good.
Were there any other resolutions that anybody needed to pull out, or are we all set?
We're all set for me.
All set.
Oh, good. Thank you.
Okay, so I just need a motion to accept the slate of resolutions and then someone to second it.
Motion.
Moved by Ron.
I'll second it.
Second by Greg. Any further discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries. Other business, we have proclamations. Cassandra, would you like to read those, please?
Yes, thank you, Mr. Chairman. The first one is proclamation commemorating May as Foster Parent Recognition Month. Whereas May is National Foster Care Month, we reflect on the dedication of foster and kinship caregivers, faith-based and community organizations, and child welfare professionals who are improving the lives of children and youth in foster care throughout Lewis County. And whereas Lewis County is deeply indebted to these selfless and compassionate families, we also observe this month with sadness for the fight of innocent children who are in foster care because their lives have been disrupted by neglect or abuse. And whereas providing a stable, secure, and nurturing home environment is one of the greatest gifts a foster parent or guardian can give a child. This critical investment in their well-being, safety, and sense of belonging brings precious hope to children in need. We acknowledge with gratitude the tremendous sacrifices made by Lewis County foster families as they open their hearts and lives and provide secure and supportive homes for infants, children, and youth in foster care. Now, therefore, I, Lawrence L. Dahlhoff, Chairman of the Lewis County Board of Legislators, do hereby proclaim the month of May 2020 as Foster Parent Recognition Month in Lewis County and urge all citizens to come forward to do something positive that will change the life of a child in foster care. I further recognize and thank all Lewis County foster parents for their commitment and dedication to our foster children.
Amen to that.
Yeah.
Proclamation commemorating May as Infant Safe Sleep Month. Whereas all children in New York State and everywhere have the right to be safe and to be raised in an environment that protects them from any potential harm. Whereas sudden, unexpected infant death syndrome is the sudden, unexplained death of an infant under 1 year of age. And whereas nearly 100 infants die every year in New York State due to being placed in an unsafe sleep environment. And whereas the New York State Department of Health and the Office of Children and Family Services have partnered to spread the word to parents, grandparents, and other relatives and caregivers of infants about safe sleep and preventable deaths from unsafe sleep environments. And whereas an infant's crib or bassinet should be close to the parent's bed, but the infant should not sleep in bed with parents. And whereas following the ABCs of safe sleep is the best way to prevent a sleep-related infant injury or death, babies are safest when they sleep alone on their backs in a crib with a tightly fitted sheet and no bumpers, pillows, blankets, or stuffed animals. And whereas babies should not co-sleep with parents, siblings, pets, or anyone else. And whereas babies are less likely to choke when they are placed on their backs. And whereas infants should always be placed in a safety-approved crib with a firm mattress every time they sleep, even for naps. Sofas, chairs, futons, waterbeds, air mattresses, and car seats are not safe places for a baby to sleep and increase the risk of suffocation. And whereas New York State has been a leader in supporting efforts to prevent unsafe sleep deaths by promoting safe sleep environments through early education programs in hospitals and birthing centers, and in distributing cribs to local departments of social services and community-based organizations so that families in need have the resources to provide a safe sleeping environment for their infant. And whereas New York State delivers the safe sleep message through social media, transportation hubs, messages heard by citizens contacting the state, and through the news media. And whereas the New York State Office of Children and Family Services, the Department of Health, and counties statewide join to recognize May as Infant Safe Sleep Month in New York State, all New Yorkers are encouraged to direct their attention to this critical issue and to support programs that promote safe sleep environments for infants. Now, therefore, I, Lawrence L. Dahlhoff, Chairman of the Lewis County Board of Legislators, do hereby proclaim the month of May 2020 as Infant Safe Sleep Month in Lewis County. Proclamation commemorating May as Mental Health Month. Whereas mental health is essential to everyone's overall health and well-being, and whereas all Americans experience times of difficulty and stress in their lives, and whereas prevention is an effective way to reduce the burden of mental illness, and whereas there is a strong body of research that supports specific tools that all Americans can use to better handle challenges and protect their health and well-being, and whereas mental illnesses are real and prevalent in our nation, and whereas with early and effective treatment, those individuals with mental health illnesses can recover and lead full, productive lives. And whereas each business, school, government agency, health provider, organization, and citizen shares the burden of mental illnesses and has a responsibility to promote mental wellness and support preventive efforts. Now, therefore, I, Lawrence L. Dahlhoff, Chairman of the Lewis County Board of Legislators, do hereby proclaim May 2020 as Mental Health Month in Lewis County. Furthermore, as Chairman of the Legislative Board, I also call upon the citizens, government agencies, public and private institutions, businesses, and schools in Lewis County to recommit our community to increasing awareness and understanding of mental health, the steps our citizens can take to protect their mental health, and the need for appropriate and accessible services for all people with mental health illnesses at all stages, and especially before stage 4. That is it.
You're muted, Larry.
We need a motion to go into executive session for personnel discussion.
I'll make it.
Second.
Tom,
Second.
second by Randy. All in favor?
Aye.
Aye.
Opposed? Okay, we're in executive session.
Okay, hold on just a second because I need to stop the recording and I also need to have the media disconnect.
Okay. Let us know when you're ready.
Larry, this is Jerry. I'll be staying part of the discussion.
Yep, that's
Okay.
fine, Jerry.
Alrighty.
Okay.
Go ahead, we're recording.
Moved by Phil to come out of the executive session. Have a second?
Second.
Greg, all in favor?
Aye.
Aye.
We're back in regular session. You need a minute to call the press? Yes?
No, it doesn't look like any of them are waiting to get in, so we can just proceed.
Okay.
All right, I'll make a motion that we authorize Ryan to proceed with the plan that he has presented to us regarding furloughs.
Been moved by
and-
Phil. Do I have a second?
I'll second.
Tom? Any further discussion? All in favor?
Aye.
Aye.
Opposed? Carries.
I'll make a second motion that we cut legislator pay 10% till this is over.
I'll second it.
Second by Ron, discussion. All in favor?
Aye.
Aye.
Opposed? Carries. Well, further clarity on that for how long, Phil?
And effective
Well,
when?
let's do
Mr.
it for
Chairman?
the same period as this furlough for now.
Okay,
May 18th to July 31st. That sound all right?
okay. That all right with everyone?
Fine with
That would
me.
be-
Yep.
Okay, what else do we have? Joe, do you have anything else?
No, that was it.
Jerry, Kay, or any further comments?
No. Have a nice evening, folks.
You too, Jerry.
Anyone else have anything they'd like to bring up? Motion to adjourn.
So moved.
Ron, second by
I'll second it.
Second.
Greg. All in favor?
Aye.
Aye.
And we're adjourned.
Ultra
Have a
time.
good evening.
Good night.
Good night.